السلام عليكم ورحمة الله. In this lecture, we will talk about the consumer health informatics, mHealth, and telemedicine. Our learning objectives today are to define the consumer health informatics, identify electronic tools for patient to physician communication, discuss the future of consumer health informatics, list the various types or the various ways mobile technology is currently being used in healthcare, compare and contrast mobile technology for clinician and patients, identify the challenge of mHealth, state the differences between telehealth and telemedicine, and we will list the various types of telemedicine consultations such as teleradiology and teleneurology, and we will list the potential benefits of telemedicine to patient and clinicians. So we will start. Consumer Health Informatics, CHI, can be defined as information and communications technologies that are tailored to consumers sick or well and used within the context of managing health or healthcare issues. So the goal of the consumer health informatics mainly is to empower the consumers to manage their own health by bridging the health literacy gap and allow the consumer to participate in the decision making about their health. Usually the decision making about the patient health before was taken by the physician who has the knowledge. But now with the internet and with the medical the access of the medical information on the internet and everywhere, the patient usually search about their symptoms and about their condition, and they can have opinions and they can share these opinions and participate in the decision making about his health with the available information. How to achieve the goal of empowering consumer by using technology. So we can improve the consumer access to medical information and care, and we will improve the consumer communication with physicians and other patients, so the patient can support each other and share their experience. Generally, make the healthcare process more efficient and active. So in this slide, we will discuss the consumer health informatics interrelationships and what consumer health informatics consists of. So we said that consumer health informatics allows active involvement of patients or consumers with their electronic health information, and that makes them make the patients or the consumers more active participant with technologies such as electronic health records and patient portals. So the main components, we have first the consumer, device, method, application, and contact. So the consumer with his device, computer, cell phone, tablet, home monitoring devices, and using various methods like voice, SMS, internet, or email, and through different applications, web apps, web portals, smartphone apps, secure messaging, electronic visits or e-visit, and personal health records. He can contact the physician, hospital, ambulatory provider, insurance company, and electronic health records. And he will return with the information that will be useful to him. An example for electronic consumer health informatics application, we have Saha app, which is a smartphone app provided by the Ministry of Health in Saudi Arabia. So here the consumer can use his device, which is um, a cell phone or a smartphone, and through different methods, either text or voice or video, he can consult one of the physicians uh, by using a smartphone app, as we said, and he can contact the physician and consult him, and he will have answers to his problem. So the rationale of consumer of having consumer health informatics uh, affected by several factors uh, that includes the widespread availability of internet in 1994, which opened the door to consumers searching for medical information, and also the spread in home broadband adoption and the growth of wireless and mobile internet access have also contributed to the growth and interest in consumer health informatics. Uh, Consumers are increasingly comfortable using the internet as a research tool for condition and treatment information and as a first line of defense to help them to manage their own health concerns. And there are also other national and social trends have also contributed to the growth of the field of consumer health informatics, such as um, now the predominant diseases that affect our society today are the chronic disease, uh, like cancer, diabetes, cardiovascular diseases. These diseases often last with the individuals for 20 or more years. And the humans live longer today, um, and the age is range between 65 to 86, which present this challenges to the healthcare system because in addition to the much higher risk for having a chronic disease, usually senior citizens have more than one chronic illness, and also these seniors, they need chronic disease related care and needs, and they will have also more years to live than those living generations ago. So now with the available health system, the humans are living longer than before, and the health problems increased uh, with uh, with them. So the emergence of the internet and related electronic technologies also presented new opportunities for healthcare to enable the consumers to interact directly with the healthcare system online, and it's also improved the possibilities for institution to institution transmissions of data. So the data of the patient data can travel from one healthcare organization to another. And there are new possibilities for peer-to-peer communication among the patients and the caregivers and also the consumers. So we can categorize consumer health information, informatics applications into the following categories. So we have mobile apps, like we have here the health app, and we have also here the WebMed app. Also, there is health information oriented websites, and there are interactive health games. There are sensor-based tracking system like the smartwatch that can track um, the exercises, and there are health oriented social media. So there are social media apps that are that focus on the health uh, problems, and there are also virtual reality programs like this program that can show you the anatomy of the human body. So we have many and various categories of consumer health informatics now. So not all the health apps for consumers. Some of the medical apps are not designed to target the public. Some apps have been designed for healthcare practitioners, and others are for patients but require a prescription or prescription, and the others are intended to only specific groups of population. Here we will focus on the health apps that are widely available to the general public and designed to aid the consumers' everyday health and healthcare management tools. As talked earlier, most adults use the health-related websites as their premier resource for health information. Uh, One reason for that is that patients now they are becoming more uh, knowledgeable, uh, and they want to have more choices uh, about all aspects of their healthcare. They are now uh, they are not accepting the opinion of their physicians directly or automatically. Uh, Also, some cases they look online for answers. They were too hesitant or to ask or too shy to ask their physicians about it, or forgot to ask him. So the following here, they are only a sample of the many valuable patient education websites available today. So we will start with WebMed or WebMD. This is an extensive health library site with a top topic listed for men, women, and children. It has treatment and drug information, and also symptom checker tool, which provide the patient with simple differential diagnosis based on their symptoms, age, and gender. So the patient can enter his age, gender, and the symptoms, and the tool will suggest some um, problems or diagnosis for his condition. And uh, we have the Everyday Health, and this is a free website offers disease information forum and health calculators, a physician finder, and also symptoms checker. And we have the Midline Plus, and this is the premier free patient education site, which developed by the uh, National Library of Medicine and the National Institutes of Health, and it has links to the best and most respected websites such as Mayo Clinic, uh, and it was ranked as the top information news website uh, for the American consumer. Then we have the Health Finder, which is a government-funded website, provides resources on a wide range of health topics. We have up to date for patients, so this is extremely popular physician education site. It has also patient education site aimed at college educated patients. So here it will have detailed information for uh, the college educated patient. And we have the family doctor. This is American Academy of Family Physicians sponsors website. It has information cover all age groups as well as over-the-counter drugs and a large library of health videos. So over-the-counter drugs, they are the drugs that they don't need prescription uh, uh, for the patient, so the patient can buy it from the supermarket or from the pharmacies, for example, like Benadryl, Fifadol. uh, Usually you can buy it from pharmacy or a supermarket or hypermarket. Health-wise, it's multiple companies sell patient education for use on commercial medical websites. This is a non-for-profit company that provides more than 6,000 topic or medical topic in their knowledge base. And we have the lab tests online. This free site allows for searching by test, disease condition or screening, and it's well organized with excellent resources for information about clinic tests or clinical tests, um, the result and what are the abnormal result mean, and other topics. One of the consumer health informatics application or app is the patient web portals. Um, we can define the patient web portals as secure web-based programs for patients to access health-related services using a secure username and password or other authentication methods. So the web portal can be a standalone program or it can be integrated with the patient electronic record or the medical electronic record for the patient. It allows the patient to receive summaries and also lab results, radiology results, and most of the patient portals, they offer multiple services like the uh, lab result notification, online scheduling appointment, and also they can refill medication, they can request refill medication, and the patient will be able to access their electronic record, and this will save time and money. So The patient use portals to clarify the doctor's instructions, to prevent medical mistakes, and also to change the way patients manage their health. They will be in control on their health. So here, this is an example for the patient web portal application, the MNGHA Care app, which is an app provided by the uh, MNGHA, and you can download it from the Apple Store or Google, and also you can use it by using your medical record and a password as an authentication method to enter the uh, to your information or to access your information. You can edit some of the information, and you can receive other information like the lab result, your schedules, your appointments, your scheduled appointment, also the vaccinations. You can have also um, uh, a refill medication. You can check your lab test, your radiology test through this application. So here we will discuss common features of patient web portals. Uh, we have the online registration. So here the patient will be allowed to complete insurance and demographic information before an office visit or hospitalization, like their weight, their height. And here there are the medication refills where you can send a secure messages for the physician to refill or renew the medications uh, instead of telephone calls. Laboratory results. The patient here can find results on recent tests as well as an explanation. The electronic visits. Some portals has or facilitate the electronic visit, and the payment process will be online. Patient education. Links to common educational sites about the patient condition. Personal health records. So it allows the patients and their families to create and update their personal health records. Online appointments, it allows the patient to see what appointments are available and when, and he can schedule or book an appointment. Referrals, the patient can request referrals to specialists, for example, uh, OB-GYN, the OB-GYN, and securing messaging here more convenient than playing phone tag, so you can send a message and you will receive the answer. Bill paying, some for private organization. Online payment using a credit card will be faster than the snail mail or the regular mail. Document uploading, here several portals, and it allows uploading of medical records to their site, and download information from the portals. Tracking function, here the portals allow patients to upload diet, blood sugars, blood pressures, and other information. Uh, Now we will move one of the consumer health informatics type, which is mobile health or mHealth. Stands for mobile. So we can define mHealth as the medical and health practice that allows people to access quality healthcare services through software application installed on their mobile devices, such as smartphones, patient monitoring devices, and personal digital assistants, which we call it PDAs. The mobile technologies, particularly the smartphones, now they are extremely popular to all members of the healthcare team. And the reasons for using mobile technology in health is um, the new mobile devices, they are lightweight, have uh, longer battery life, excellent screen resolution, and extensive medical apps, convenient form factor. And also it's important to keep in mind that the tablets and smartphones have access to the internet. So all of these are reasons for having mobile mHealth or in our mobile devices. It improved the speed because of the improved speed, memory, wireless connectivity, and shrinking form factor, the size and the shape. It's easy to travel with mobile devices. It's affordable. All nearly everyone now has a mobile device. It has constant improved features, and the phone capabilities. You can have voice calls, email, and also access to internet. And there are a large number of mobile apps available for consumers and clinicians that can be used on their mobile devices. Challenges of adapting mHealth, the cost to make or to distribute mobile devices to all healthcare workers and staff. It will be very expensive. Uh, but in spite of that, usually the healthcare workers are purchasing smartphones and tablets and paying data charges. The technical and issues like for inputting screen size and interoperability issues, uh, also a challenge. For inputting information, usually is slow but improving constantly with the new technologies such as voice recognition and pattern recognizing soft keyboards. So now there are technology that can overcome this problem. And the screen size, the small screen size is an issue for smartphones, but not for tablet. Uh, Also, the interoperability issue, uh, where one software need to be uh, distributed for different platforms. Um, but this is uh, covered now because most of the medical software available for multiple platforms. Privacy and security, the HIPAA compliance, because mHealth apps store electronic personal uh, health information, and this there is a rising concern where this about that this data might be used without the patient's consent, and this will be a violation of the HIPAA Act. The accuracy, so we need to make sure that the information are accurate and correct. And we have also a regularity issue because all of the mobile devices need to be regulated and cleared by the FDA, the Food and Drug Administration. Uh, To ensure that they do not have to risk on human life, and these regulations are changed and developed. Uh, are they evidence-based? So we have a lack of proof that mHealth improves patient outcomes or significantly impacts the clinician productivity. So we need a better research to objectify the use of mobile technology or mHealth. So mHealth as consumer health informatics and for clinician. Uh, as of June 2013, there was 43,689 health apps in the Apple Store. Uh, Only about half are truly medical health related, and two-thirds of health apps for consumers, one-third for physician or clinician. So the health apps can be categorized into health that inform or provide information in a variety of formats such as text, photo, and video. And there are apps that instruct or provide instruction to the user to follow or to do a procedure. Um, Apps that record or capture user entered data, and there are apps to display or graphically display user entered data or output user entered data. And also there are apps that remind, alert, or provide reminders to the users, and apps that guide or provide guidance based on the user entered information, and may further offer a diagnosis or recommended a consultation with a physician or using a course of treatment. And there are apps that communicate or provide communication with healthcare professionals, patients, and or provide links to social networks. So several electronic health records vendors, they offer a specific iPad software package for clinicians. So whenever an organization uh, buy an electronic health record system from a vendor, they also provide an iPad software that can interact with the electronic health record. Medical software also can be categories for clinician, include apps about drug information, databases, and immunization guides. So now we will move to telemedicine, and similar to the term e-health or electronic health, the telehealth is an extremely broad term, and uh, this broader term incorporates clinical, patient, and health-related education, and public health and health administration information. So it includes all the administrative transfer of information, whereas the telemedicine relates to remote transmission or exchange for only clinical information. So we can define the telehealth as the use of electronic information and telecommunications technology to support remote clinical healthcare, patient and professional health-related education, public health, and health administration. On the other side, telemedicine is the use of medical information exchanged from one side to another via electronic communications to improve the patient's health status or simply the remote delivery of clinical healthcare. So, telehealth is the broader term and it can encompass the telemedicine. So we can use the remote delivery of education, training, and administration meeting or clinical care is a type of telehealth. However, the remote delivery of the clinical care, it will be considered telemedicine. As we said earlier, telehealth is the broader term of remote health services delivery. So it incorporates the clinical care, educational, and administrative services delivery, whereas the telemedicine relates to the remote delivery of clinical care only. So in this lecture, the term telemedicine is used instead of telehealth because all the tools discussed are used in remote delivery of clinical care. So the first case of remote monitoring has been demonstrated to monitor the health of astronauts in space in the 1960s. Very basic telemedicine has been conducted using also telephone communication on the past 50 years or more. And with the advances of the internet, the video conferencing, many new modes of communications are now available. Telemedicine is becoming increasingly popular for the following reasons. Uh, with the rising cost of healthcare worldwide, new strategies provided by telemedicine to prevent readmissions to the hospital, and this means less expenses. There are or there is a shortage of specialties and primary care and intensivist physicians. Uh, Also, there are maldistributed uh, to urban and not rural areas or villages, and the remote delivery of medical care with telemedicine is a partial fix and solution. Also, there is additional uh, means needed to deliver medical care with the rise in chronic disease and the aging of the population. And with telemedicine, uh, we can improve the collaboration among physicians and disparate healthcare organizations and share the experts between the healthcare organization. And telemedicine raises the patient satisfaction, and when the patient has uh, an access to their result faster, uh, the less time lost from work and the fewer long distance trips to uh, medical centers will raise the patient satisfaction regarding the healthcare medicine. As an example is now with the COVID-19 crisis or the new corona crisis, uh, most of the hospitals, they try to continue to care uh, and to manage the care, the health care of their patients through telemedicine, either by telephone or e-visit, electronic visits, or other telemedicine tools. Uh, so telemedicine can be a solution for disaster situation also. So there are three telemedicine transmission modes اللي هي 3 طرق للنقل. First, store and forward. Here the images will or the videos will be saved and sent later. For example, the physician at the clinic will take a picture of a rash with a digital camera, so with his smartphone or digital camera, and forward the image to a dermatologist to view it when uh, when he has a time. This method is commonly used for specialties such as dermatology and radiology. Uh, and this also could be referred to as synchronized communication اللي هو تواصل غير متزامن. لأن الصورة يرسلها الشخص، مثلا يرسلها الدكتور للأخصائي أو للاستشاري، بعد كده الاستشاري يشوفها متى ما سمح له ويعطي رأيه للأخصائي، فيكون التواصل غير متزامن، مو في نفس الوقت. Then we have real time. Here the patient and the providers use video conferencing software to hear and see each other in real time, like here. So the specialist at the medical center views video images transmitted from a remote site and discuss the case with another physician or with the patient. And this requires more sophisticated equipment to send the images and often involves two-way interactive telemonitors. So the specialist is able to see the patient and ask questions, and this would be an example of synchronized communication اللي هو تواصل متزامن لأنه يحصل بنفس الوقت. Remote monitoring monitor patient at home or in a nursing home, usually part of disease management, like monitoring glucose level of diabetic patient. So here this technique to monitor the patients either at home or nursing home or hospital for personal health information disease management. So here in this table, there are several of communication modes for or ways that use in telemedicine along with the pros and cons اللي هي طرق الاتصال. We have patient portal secure messaging. The pros of this method it's asynchronized اللي هو تواصل غير متزامن مو في نفس الوقت. Able to attach photos. The response can be formatted with template, and also it can use a voice over IP, and there are audit trail to check and return to it for better for quality performance strategy. And also we have the cons, which are not as personal as live visits. Usually, it's not connected to the electronic health record or other enterprise information, but maybe they will integrate it in the future. The next mode is telephone, which is widely available. It's simple and inexpensive. Nearly everyone can have access to make calls, and it's real time. Uh, the cons will be synchronized, and it's unstructured, so there is uh, it's not structured data, so it will be difficult to be computerized, no audit trail, and also only real time. There is no asynchronous transmission. The audio video mode, here the maximal input to clinician, because the clinician can review x-ray, radiology test, and other tests. It's more personal than just messaging. The cons, currently it's the most expensive in terms of networks and affording the specific hardwares, but this is changing with the uh, advances in mobile technologies. So we can categorize telemedicine into the following categories. We have televisits, telesurgery, which is the ability for a doctor to perform surgery on a patient even though they are not physically in the same location, and teleconsultations, which can be used for teleradiology, teledermatology, teleneurology, and telepharmacy. And the last category is telemonitoring, and it can be done through two ways. Telerounding tools, which use to monitor the inpatients using telerobots or electronic ICUs, and telehome care, where the patient who are monitor the patients at home with sensors. So the monitoring will include physiological parameters and also the activity and the diet of the patient. Teleconsultation, it's a worldwide phenomena because specialists tend to practice in large metropolitan areas. The new medical workers usually receive their training at metropolitan areas, such as the cities, the main cities, and not in the rural areas, the villages or the towns. And most programs consist of a central medical hub and several rural areas, and the program attempt to improve the access to services in rural areas and undeserved areas, to include also the prisons, and this will reduce the travel time and lower the cost for the specialist and the patients alike. So there will be no need for the specialist or the patient to travel from uh, their living area to uh, another area to provide or to receive the appropriate medical care, and this is will with lower the cost of traveling and accommodation and transportation also. The most commonly delivered services are mental health, dermatology, cardiology, radiology, and orthopedics. The first example of teleconsultations is teleradiology. Teleradiology was introduced partly due to the shortage of radiologists and uh, the increased workload and also to enhance the radiology support for military and to help the smaller hospital and supply them with radiology services remotely from far. Teleradiology is the practice of radiologist reading a film or um, an image home after hours, and they must have uh, high resolution monitors with high speed connection to the internet, and they will dictate their report via voice recognition software, and it hosts it all in the cloud. So they will upload their report to the cloud for others to view and review, and to be linked to the local electronic health record. So the radiographer acquires the image. So أجهزة الأشعة تأخذ الصورة, sends the image to the cloud, and um, according to the image, there will be an analyze and choose the best suited radiologist for diagnostic, and the radiologist examine and upload his report to the cloud. Then the physician will receive the examination results. The second example of teleconsultations is teledermatology, and with the advance of good quality digital cameras and cell phones, and with the smartphones, the concept of teledermatology was born. The goal here is to provide free worldwide dermatology expertise, particularly for the third world countries and the undeserved area. طبعا لتوفير اللي هم أخصائي الجلدية أو خبراء أخصائي الجلدية لدول العالم الثالث أو للمناطق المحتاجة عن بعد. So the physician can easily obtain the teleconsultation and diagnosis, and also the therapeutic advice using the store and forward, which is the most common mode. And it was designed for those patients who were traveling or did not have access to their physician and had a new skin condition. The patient can take a picture of their skin lesion with the digital camera or with their smartphone or app available, and forward it as an attachment to or through a text message, and it would be followed by a response from the dermatologist within few hours. The image can also be integrated with a personal health portal, um, and there are several international initiatives that support teledermatology um, to provide it for the undeserved and rural area. And the goal here to provide better service and answer requests and decrease the face-to-face visit to dermatologist. Under telemonitoring, we have telerounding, Rounding is the act of going to the bedside of hospitalized patient to see and evaluate their conditions. So T-rounding mean remotely rounding. And we have two types of T-rounding. We have robot rounds, which is the control of robot from distance to perform bedside rounds. Here the surgeons will make a second set of rounds using a video camera at the patient, bedside robot, a physician assistant makes the actual rounds backed up with the robot or the physician remotely. Um, the robot also has a computer monitor as a head, and they can move around and they can project X-ray result and other result to the patient. So the physician can see and check the patient, and the patient can ask the physician uh, also and answer the physician question. Virtual ICU or electronic ICU, uh, due to the shortage of physicians who specialize in ICU care, and also with ICU beds increasing, there is a need for electronic ICU or virtual ICU. Here, there will be a remote monitoring uh, uh, can be done, and the electronic ICU service may be less expensive than recruiting full-time ICU staff, and it provides two-way video and audio communication, standardization of care. So there will be a standardized of care for all patients, uh, clinical decision support, and also robust graphical displays of physiological data. So the doctors or the intensivists can monitor their patient remotely through monitor. They can communicate with them also, uh, and display their data. So the second type of tele monitoring is tele-home care, which is remote monitoring of the patient at home or hospital or nursing homes. And the concept here is monitoring patients at home may prevent unnecessary emergency room visits and hospital admissions, uh, and it usually involves monitoring the vital signs, the weight, the blood sugar, and also they can be this signs can be sent via a wired or wireless mode uh, from homes to a physician's office or clinic. The home monitoring usually focus on managing chronic disease and post-acute care monitoring. The goal here is to uh, better educate and monitor the patient at home, um, while reducing the uh, readmissions uh, and unnecessary emergency room visits, and as a result saving the money. So home monitoring, a new sensor will transmit information to the physician office or a healthcare organization. And the programs now, they are interactive, includes the patient education for issue such as drug compliance, and this data may interact or integrated with electronic health records or websites for others to evaluate. And the information would be transmitted to a central organization that would notify the patient or the family uh, if there was non-compliance or any warnings or alert about a specific drug. So, um, unfortunately, most home care studies have not shown a significant impact on medical quality and cost until now. So there is a need for research about that. So this is an example for telemonitoring Health Buddy device. Health Buddy is a FDA approved device. It's used for or by veterans home telemedicine programs to increase the medication compliance and reduces the outpatient visits. So they will follow the patient and uh, make sure that the patient takes his drug and follow his medication. And the data will be sent over telephone lines, okay, wirelessly, wireless telephone phone lines through a network, and the devices will come with a desktop decision support software. So based on the information, the patient information, a decision support will be taken. Programs will cover 45 disease protocol, uh, and the devices connect to the health body will be glucometers, PP, blood pressure machine, and also um, weight scale and peak flow meter for asthmatic, and all of the data from this monitoring device will be sent to the patient interface, where it communicate or transfer the data through the wireless phone line to the healthcare secure data center, and the software based on the data will take uh, risk stratified decisions, and based on the decision, the care manager will give his feedback and return with the feedback to the patient. And there will be also interactive communication between the patient and the care manager, who will contact the patient daily and ask him questions about his health.